So first, with the case, I will show you the different patterns of maturation. I'll show you the various markers, how they are contributing in seeing the patterns of maturation, and along with that, I will show you the expression of the LAIP markers that are seen or that are not seen in all the normal staged precursors or hematogone levels. So basically, whenever we are seeing a case of BLL MRD, we have to focus on the target population, that is the 19 positive cells, because we are analyzing a BALL MRD. So it is a pan lineage marker is 19. So basically, we have to see only the 19 positive cells if the leukemic blasts that are present are 19 positive and are showing various LAIP markers or not. So that is the primary gating that we have to use. A 19 gating strategy has to be used. So basically, I'll show you what pattern or what approach I follow. So this is first I take up the singlets. This singlets meaning that we are ruling out or taking out the doublets, and these singlets have to be put forward under the forward scatter and side scatter plot, where we remove out the debris, and the debris has to be cleaned, and we have to just analyze the non-debris cellular events. And these non-debris cellular events we take up here again on CD38 versus side scatter plot, where we get the MNCs only. So we just have to analyze the MNCs. Why? We don't have to see the granulocytes. We know that the granulocytes express high side scatter along with the dimmer CD38 expression. So these granulocytes don't have to be analyzed. Our population of interest lies over here. So these cells with a dimmer CD with a lower side scatter and 38 variable expression has to be our population of interest. So basically, this is the MNC gate or mononuclear cell gate, where we include everything, including from the erythroids to the plasma cells, the lymphocytes, the monocytes, the myeloid blasts, the hematogones, everything fall under this gate. So basically, we have to analyze this population only. So this population MNCs, we just take up the MNCs, and from the MNCs we have to draw down the 19 positive cells and analyze them. That is the basic fundamental that we are going to follow over here. So this is from the MNCs we have drawn the 45 versus side scatter plot, where we are seeing all the cells lying in the MNC. We are not seeing any granulocytes over here. Why? Because we have taken out the granulocytes. We have taken out the granulocytes, and here we are seeing only the cells that are present in the mononuclear cell gate. So in the mononuclear cell gate, you can see some population in red, some population in purple, some population in green. So we'll analyze in the next slides, where we'll see what are these populations basically. But again, as I said, we have to take up the MNCs and we have to put them on under CD19 versus 45 plot. And on 19 versus 45 plot, we'll take up only the 19 positive cells. So I hope everyone knows that we are analyzing a BLL MRD. So we have to analyze the 19 positive population only. So what are the various progenitors of BLL MRD, the B lineage that we are going to see? So this is a question for everyone in the participants, is what are the various 19 positive populations that we can see in the bone marrow sample that we are studying? Okay, so we have the mature lymphocytes, we have the stage 1, stage 2, stage 3 hematogones, and we have the plasma cells. So these are the basic cells that we have to analyze, and we have to differentiate the leukemic cells from the stage 1, stage 2, and stage 3 hematogones versus the leukemic cell phenotype. So we have taken up the 19 positive cells from this with a broad gate on CD45 axis, and because our leukemic cells can be 45 dimmer, we can have a 45 bright cell, we can have a 45 moderate cell. So basically we have taken up the 19 versus 45 broad gate, and these 19 positive cells have been further refined on side scatter forward scatter plot. We have removed the junk over here. Possibly these are some erythroids and from some granulocytes overlapping, which are 19 negative, and with a low forward scatter and a high side scatter, possibly some granulocytes. And again, we have cleaned these 19 positive cells here on 19 versus side scatter plot, and again we have finally made it junk free, and we have put it under CD38 versus CD10 plot, where we have to exclude out the plasma cells. So plasma cells, the normal plasma cells, will always express a 19 along with bright CD38 expression, and CD10 should not be expressed in these cells. So we are seeing the blue cells here, which are expressing bright CD38, and they are not expressing CD10 anywhere. So these are the plasma cells that we are seeing, and we are seeing some cells over here which are not which are basically not plasma cells, and they are showing bright CD10 expression. Some are showing some dimmer CD10 expression, and some are showing 38 dimmer expression with a negative CD10 expression. So basically this is the final event that we have to analyze, or the 19 positive events that we have to analyze, excluding the plasma cells. So this is the gating strategy that we have to follow in all the BLL MRDs that we report. So again, I'll give a quick recap that first we have to take up the singlets, and the singlets have to be again refined on the non-debris cellular events. Then the non-debris cellular events have to be put in the CD38 versus side scatter plot, where we take out the MNCs or the mononuclear cells, and these MNCs have to be put under CD19 versus 45 plot, where we have to take up the 19 positive cells only, and we have to analyze them here on CD10 versus CD38 plot, where we have to exclude the plasma cells, and final CD19 positive cells have to be analyzed. So moving on to the next plots, where we see the patterns of maturation. So first one is the CD10 versus CD45 plot, where there is stage 1 hematogone, there is stage 2 hematogone, and there is stage 3 hematogone. I have already labeled it so that I make it easy for you guys, where we can see the stage 1 hematogones, which are expressing bright CD10 and a dimmer CD45, and stage 2 hematogones, which is losing its CD10 and gaining CD45 basically, and a dimmer CD10 and gaining CD45. And gradually we see some stage 3 hematogones which have lost its CD10 completely and have become bright CD45. So this is the pattern which we have to see on CD10 versus CD45 plot. Again, this is one plot where we're seeing the pattern of maturation, or reverse C sign we can see. And on CD10 versus CD20 plot, again we can see the stage 1 hematogones, the pink ones, are showing CD10 bright expression, and gradually and they're not at all showing any CD20 expression. Once the stage 1 hematogone starts moving towards stage 2 hematogones or the Aberrant cells, they start losing their CD10 and they start gaining their CD20. And on stage 3 level, the mature B lymphocytes, they have completely lost their CD10 and they have become bright CD20. So this is the pattern that we are seeing over here, and this is called classical waterfall pattern. So this is the waterfall pattern that we see on a plot of CD10 versus CD20, where the final CD19 positive cells or events have been put, and we have excluded out all the plasma cells, and the final CD19 positive events have been put over here, and we have to see that if the normal pattern of maturation is being followed or not, and if it is not being followed, then this could be a possible MRD. So this is a normal pattern of maturation, or the waterfall pattern. CD10 versus CD58 plot, again we are seeing some CD10 bright expressing cells, or the pink cells, which are stage 1 hematogones, and they don't overexpress any CD58. And the stage 2 hematogones are also not overexpressing any CD58, and they have started losing the CD10. And and the stage 3 hematogones again have completely lost their CD10 and they are not overexpressing CD58. So this is the pattern that has to be seen on all the normal cases. If there is some event present over here, then these could be possibly the leukemic cells, because the overexpression of CD10 and CD58 can be seen in the leukemic cells. Then we have the CD38 versus CD45 plot, where there is moderate expression of CD38 in stage 1 hematogones, and there is dimmer expression of CD45 in this plot. Then there is stage 2 hematogone, where they again express moderate CD38, but they have started gaining CD45. And these are the orange cells, or the stage 2 hematogones, and the stage 3 hematogones, where they have gained CD45 completely and they have become a brighter CD45, and they start losing their CD38 here. So this is the classical pattern that we see on a CD38 versus CD45 plot. And on CD45 versus CD34 plot, we have the brightest 45 being the stage 3 hematogones, then stage 2 hematogones, or the orange ones, and stage 1 hematogones, that are the pink ones, which are showing brighter expression of CD34, and stage 3 hematogones, which are not showing any CD34. So basically this is the pattern that has to be seen, or the banana sign that we have to see. Then there is CD73 versus CD34 plot, where we are not seeing any event that is overexpressing CD34 and CD73. There is the stage 1 hematogones which are showing bright CD34 expression with no expression of CD73. There are some stage 2 hematogones as well, which are showing some CD34, and there is no overexpression of CD73. And these are the mature B or the stage 3 hematogones, which are also not showing any overexpression of CD73. These are some scattered cells that are present, but these are basically stage 3 hematogones. And then there is the CD123 versus 34 plot, where we have overexpression of CD123. I would like to ask everyone that what are the cells on, what are the mononuclear cells that overexpress CD123 or show bright CD123 expression? Yes. So basically, these are the possible basophils, or these could be the plasma cytodendritic cells that are showing overexpression of CD123. So how can you differentiate between a PDC and a basophil? So basophils will not show any HLA-DR, but they will express 123, but PDCs will express HLA-DR and 123 bright expression. But yeah, now why am I using a 123 control over here? So that I can see the expression, or say what kind of expression is being seen on the stage 1 hematogones for CD123. So whenever you're seeing an LAIP marker, I would like to request you all to put the normal control so that you can know that what kind of expression is being seen in the stage 1, stage 2, stage 3 hematogon, so that you don't miss out on the leukemic cells. So basically, stage 1 hematogones, as we already know, the pink ones are stage 1 hematogones. They're not at all showing any CD123. This is the CD123 normal expression, and this is completely negative CD123 expression. So basically, these are negatives for CD123 on stage 1 and stage 2 and stage 3 hematogones. None of them are showing 123 expression. If the cells were present over here, then they would have been positive for CD123 or close to 123 expression, or even over here, if they were present, they could have been bright expression of CD123, which we are not seeing over here. So these are normal hematogones that we are seeing. So apart from that, whenever we are reporting the MRD, we have to see that 34 positive cells that are present, if the normal myeloid blasts are present or not. So basically, why am I calling these as normal myeloid blasts? Because these are 1910 negative, the red ones, and these are 3438 moderate expression, and these cells are completely from the negative 19 region, the red ones. Remember the red ones. The red ones here we can see on the 1945 plot that these are coming from the 19 negative region, and on 45 versus side scatter they are present in the myeloid blast region. So basically these are the normal myeloid blasts that we are talking about. So these are things have to be mentioned in the MRD report. So that's why we are calculating these cells. So this is a case of classical normal BLL MRD, where we are seeing normal patterns of maturation, and there is no overexpression or no underexpression of any LAIP marker that we are seeing over here. Okay, so moving on to the next case. So this is a case of a 43-year-old female who was a diagnosed case of BALL and has completed maintenance therapy. Currently has presented with bone marrow, bone pain, fever, high-grade fever, and chills since last 5 days. So basically, the patient has completed all the treatment, but now the patient has presented with bone pain, high-grade fever with chills since last 5 days. So bone marrow studies were done for disease assessment and MRD studies. So first we'll start with the plots and the approach that we already discussed. That first we'll take up the singlets, and from the singlets we'll draw the non-debris cellular events. We'll exclude these cells which are possibly some doublets and some erythroids. So we'll rule these out, and we'll or possibly some debris, and we'll rule out these debris, and we'll take up the non-debris cellular events on the 38% side scatter plot, and we'll gate them as MNC gate because we don't need the granulocytes. We'll exclude the granulocytes, and we'll take up the MNCs. These MNCs will put under 19 versus 45 plot, and these 19 positive plots will make them junk free from side scatter forward scatter plot, and 19 versus side scatter plot will make them even more junk free, and we'll make a final junk free 19 positive cells, and we'll put them under further gates and analyze them. So I hope everyone remembers this approach, and the 19 positive cells have to be analyzed only. Now I don't want you all to focus on the red cells, but we'll further analyze the red cells, what expression these red cells are showing, and if it is MRD positive or negative, or these are normal hematogones. So again, from the next plot, we can see that there are some plasma cells present over here, which are showing bright CD38 expression with a negative CD10 expression. So basically, we have taken out the plasma cells and we have to analyze these final 19 positive plots. So we are seeing a large cluster of cells that are bright 10 positive and dim CD38. This stage 1 hematogones, can anyone tell me what kind of expression the stage 1 hematogones show on CD38 versus CD10 plot? What is the expression of CD38 on stage 1 hematogones and stage 2 hematogones? So basically, stage 1 and stage 2 hematogones show a bright CD10 expression and a moderate CD38 expression. Gradually, when they mature towards stage 2 hematogon, they start losing their stage CD10, and still they show moderate expression. But when they become stage 3 hematogones, they lose their CD10 completely and they lose CD38 as well. So basically, these purple population could be possibly stage 3 hematogones or mature B cells, but this red population is a population of interest currently for us. So on CD10 versus CD45 plot, we see the red cells, they are showing overexpression of CD10 and a dim to moderate expression of CD45. On 10 versus 20 plot, again, we are seeing this cluster of cell showing 10 bright expression and they have some 20 expression as well. There is heterogeneous expression of CD20 that we are classically seeing over here. Why am I calling this a heterogeneous expression? Because they are showing more than 2 log expression of CD20. So whenever there is a more than 2 log difference, we can call them a heterogeneous expression. So and on CD10 versus CD58 plot, we are seeing overexpression of CD58. So already we have 2-3 points which can classically say that these could possibly be a leukemic phenotype of the cells, because CD58 overexpression is never seen on stage 1 hematogones. Underexpression of CD38 is never seen on stage 1 hematogones, and CD20 heterogeneous expression is never seen on stage 1 hematogones. So these are the points that have to be taken care of, and this is pointing us that these could be abnormal leukemic cells. CD34 expression, we are seeing there is again a heterogeneous expression which is not seen on stage 1 hematogones. Stage 1 hematogones usually show a 34 homogeneous expression and a dimmer CD45 expression. So already on these plots we are able to think that these could be possibly abnormal cells. So on 10 versus 34 plot, we are seeing some heterogeneous expression of CD34 and bright expression of CD10. And on CD34 versus the 81 plot, we are seeing that there is underexpression of CD81. So why am I calling this underexpression? Because the mature B lymphocytes that we get it on this plot, that is 10 versus 20 plot, we are seeing some mature B lymphocytes, the purple cells, they usually have a dimmer expression of CD81. So these cells are even expressing lesser expression of CD81 than the dimmer B lymphocytes. So this is definitely under expression of CD81, and there is heterogeneous expression of CD34. On 1058, we already have seen there is homogeneous overexpression of 10 and 58, and 73 overexpression is also seen over here. 123 also, I can show that there is some overexpression of 123. Usually the stage 1 hematogones fall over here, which show brighter CD34 and negative expression of CD123, but this has already touched the brightest CD123 cells over here, the CD123 brightest cells over here. And these are the 123 brightest cells, possibly the basophils or PDCs. So basically our red cells are touching 123 over here. So this is definitely overexpression of CD123. So we have all the points to call them abnormal. First, it is not following any normal pattern of maturation. Second, it is showing overexpression of CD10, CD58, CD73, CD123, and underexpression of CD38 and CD81. So all these points point towards a abnormal phenotype. So this is a positive MRD.